amazing plan for today is to perform the abdomen treatment after the open heart surgery. And you may ask why the surgery was here and I will treat my belly. Why is that? First of all, I received a few heparin injections to my abdomen and I took a lot of peptides during the recovery time, BPC 157 and stuff like that. And multiple injections in one place can cause the fascia, the connective tissue, to get rigid, which can make me feel tired, anxious, which can lead to the groin pain, lower back pain, all stuff like that. So this needs to be the least. Second of all, I had drains in my upper abdomen, 2 cables over there. I still have scars. Today we don't take care of the scars, but everything around. But still having 2 tubes for a few days inside my stomach tightened up the area. So that needs to be addressed as well. Another thing, my liver. There is one technique that I want to show you. Liver is very important and it responds very well to the manual treatment. After the surgery, you may notice that this area under the right ribs may be tender, hard like a rock, and it's because you probably took a lot of medications. And also stress. Stress is being held in the stomach, especially in the upper portion. As a protective measure, the tension there builds up and there was a lot of stress. That's why after open heart surgery, it's very important to address the abdomen. So we're gonna do a few techniques that will help me to relax the area. And obviously I'm doing that on the 10th week after the surgery. Some techniques cannot be done too rough. If you have any doubts that you may hurt yourself, just go to a physiotherapist, so they would do that for you. If you have any other health problems, if you have any other medications that you're taking, it's better to consult your doctor or a physiotherapist before doing this kind of treatment. So let's start. I will be in a little bit hunched position. Obviously I'm in the protection. I will put it a bit higher so it would not bother me. I might look very funky now. Okay, it's not the most comfortable position to work on, but I really don't want to take off this protection. My sternum still clicks quite a lot and quite painfully after 10 weeks. I want to give it all the possible protection that I can to don't regret that later. I really want that to heal. So even though it's not very comfortable and it's probably looking weird, I keep it that way. So the first technique, we're gonna release the superficial tensions around the abdomen. In majority of the people, the abdomen tissue, the fat tissue, should feel nicely, smoothly. You should not respond with pain with medium amount of pressure up to 5 kg. It should feel neutral. A lot of you, to your surprise, will find that you will have very sticky areas, especially here on top of the belly button, where you will not be able to grab anything because it will be too stuck. Some of you may find crunchy areas, and all of this will require your attention. If your hands will get tired, all of this technique you can do through the paper towel. It will help you to get a better grip. Okay, so let's start. I will firstly do a general scan. Here there is one in the middle, on the side of the belly button, another crunchy, painful place. Here, left lower. This is not that much. Obviously I can go lower, higher to the side, but this is what we are going to work on today. So the technique looks just like that. I pick the spot that is tender, crunchy, and I stretch that clockwise. Then I will break down that gently. Alright, that took a little bit longer than I expected, but releases were very nice, so we are going to continue now. Now the technique for the liver, we try to find the rib, the lowest rib. We palpate the border of that rib. We go 2 centimeters below, and this is where we dig in. Digging into the first resistance. When we feel the first uncomfortable sensations, the first resistance, we create pulsating movements 2 times per second. Once it releases, we move forward Once it releases, we push slightly more. And we continue until all of this sore, uncomfortable sensation disappears. We press inside and slightly up. Beautiful. Now we are going to work on the diaphragm. We cannot touch the diaphragm directly, but we can have some influence on the attachments of the diaphragm by working just under the ribs. So before, while working on the liver, we started to work 2 centimeters below, and then we went inside and up. Now we will go directly under the rib and we'll try to hook the tissues inside. And there's no need to work on something that feels normal, but if you feel something crunchy, something bulgy, something that feels sore, feels like a knife, give it a chance, work on that a bit. And if it's relaxing, great. If it's not relaxing, in 1 minute, 90 seconds, then just move to another place. Alright, I can definitely call it a day. It took a bit longer than I expected, but it feels awesome. I feel calm, grounded. Actually, it's a good time for the meditation. Perhaps I will go for one. Hopefully it helps someone. Take care over there.